This tutorial will walk through some basic controls to optimize B-mode image quality. We will also cover some features and when they could be helpful when using Versana Premiere. Please refer to the Versana Premiere Basic User Manual to check for any bioeffect possibilities when changing parameters. It is important to choose the correct probe and preset when imaging to start with default optimization of specific anatomy. Frequency can be adjusted based on the penetration needs of the patient. Higher frequencies improve resolution, but decreases penetration, while lower frequencies improves the penetration, but decreases the resolution. Your depth of the imaging field can be controlled with the depth rotary on the console. The depth setting should be appropriate to show the area of interest slightly above the bottom of the imaging screen. Adjusting the position and number of focal zones can be helpful in targeting the anatomy of interest for image optimization. The controls to adjust the position of the focus is the dial under the bottom row on the touch panel. Simply rotate the button to increase or decrease. The response to the image displayed can be seen here as the focus zone is adjusted from the near field to the far field. Multiple focal zones can be applied to the image for higher resolution. Push the dial to access focus number and then rotate. Keep in mind, adding multiple focal zones reduces the overall frame rate for the image. Coded harmonic imaging, CHI diminishes low frequency, high amplitude noise, and improves near field resolution and far field penetration. The user can confirm the CHI is active by looking at the upper right portion of the display. Overall gain is controlled by the rotary dial, labeled B. As you can see using this view, increasing or decreasing the gain will affect the overall brightness of the image. Too little or too much gain may result in the anatomy of interest not being seen clearly. Time gain compensation, TGC, is used to ensure the consistency of the gain levels from near field to far field. The icon labeled TGC will open digital slides on the touch panel to adjust gain for specific areas on your image. The user also has the option to either choose from standard presets for TGC configurations. The user-defined presets allow you to save customized presets by simply pressing and holding a tab under User-defined presets. The TGC function will automatically exit after a period of no use. To exit manually, press the TGC icon at the bottom of the screen. Lateral gain compensation, LGC, is used to ensure the consistency of the gain levels along the lateral direction and is located on page 2 of the touch panel. The user-defined presets allow you to save customized presets by simply pressing and holding a tab under User-defined presets. The option will automatically turn off after the user discontinues use or exit manually using the LGC icon. Gray map affects the presentation of B-mode information. Choose the gray map prior to making other adjustments, as there is an interdependency between gray maps, gain, and dynamic range. If you change a map, revisit gain and dynamic range settings. High detection speckle reduction imaging, SRIHD, reduces speckle in an ultrasound image. There are multiple levels to choose from based on your preference. Dynamic range is adjusted using the dial under the corresponding tab on the touch panel. It changes the amount of grayscale information displayed by allowing the user to control how echo intensities are converted to shades of gray, thereby increasing the adjustable range of contrast. A higher dynamic range shows more grayscale information displayed, while a lower dynamic range displays less grayscale information. Dynamic range is useful for optimizing tissue texture for different anatomy. Dynamic range should be adjusted so that the highest amplitude edges appear as white, while lowest levels, such as blood, are just visible. Crossbeam is the process of combining 3 or more frames from different steering angles into a single frame, and is available on convex and linear probes. User can choose from low, medium, or high. Frame average is a temporal filter which averages frames together and uses more pixels to make up one image to present a smoother image. Was Easy Style is a feature intended to provide different image style presentation for user to choose from. It provides different appearance on tissue smoothness, contrast, border delineation, and tissue differentiation.